Unveiling the correct approach. Regenerating cartilage for effective arthritis treatment. Introduction. Arthritis is a debilitating condition that affects millions worldwide, characterized by joint inflammation and cartilage degradation. While conventional treatments often focus on managing symptoms, recent research suggests that regenerating cartilage holds the key to long-term relief. In this comprehensive guide, we delve into the pitfalls of traditional arthritis treatment and explore innovative strategies for truly regenerating cartilage, offering hope for those seeking lasting relief from arthritis pain. Understanding arthritis and cartilage degradation. Arthritis encompasses a group of inflammatory conditions that affect the joints, resulting in pain, stiffness, and reduced mobility. Osteoarthritis, the most common form of arthritis, is characterized by the breakdown of cartilage, the smooth, protective tissue that covers the ends of bones in the joint. Over time, cartilage degeneration leads to joint damage, inflammation, and loss of function, contributing to the progressive nature of the disease. The pitfalls of conventional arthritis treatment. Conventional treatments for arthritis typically focus on managing symptoms rather than addressing the underlying cause of cartilage degeneration. Non-steroidal anti-inflammatory drugs, NSAIDs, corticosteroids, and analgesics are commonly prescribed to alleviate pain and inflammation. While these medications may provide temporary relief, they fail to halt the progression of cartilage loss and may be associated with side effects such as gastrointestinal bleeding, cardiovascular risks, and dependency. The promise of cartilage regeneration. Recent advancements in regenerative medicine have sparked interest in strategies to repair and regenerate damaged cartilage. Unlike traditional treatments that merely mask symptoms, regenerative therapies aim to restore joint function by promoting tissue repair and regeneration. By targeting the root cause of arthritis, cartilage degeneration, these innovative approaches offer the potential for long-lasting relief and improved quality of life. Exploring regenerative therapies for cartilage repair. Platelet-rich plasma, PRP. Therapy. PRP therapy involves extracting and concentrating platelets from the patient's blood, then injecting the platelet-rich plasma into the affected joint. Platelets contain growth factors and cytokines that stimulate tissue repair and regeneration, promoting cartilage healing and reducing inflammation. Clinical studies have shown promising results with PRP therapy, demonstrating improvements in pain, function, and cartilage quality. Mesenchymal stem cell (MSC) therapy. MSC therapy utilizes stem cells derived from bone marrow, adipose tissue, or umbilical cord blood to regenerate damaged tissues, including cartilage. MSCs possess the ability to differentiate into various cell types, including chondrocytes, the cells responsible for cartilage formation. By delivering MSCs directly to the site of cartilage damage, this approach aims to stimulate new cartilage growth and repair damaged tissue. Tissue engineering and scaffold-based approaches. Tissue engineering techniques involve seeding cells onto biocompatible scaffolds, creating a three-dimensional environment conducive to tissue growth and regeneration. These scaffolds mimic the structure and function of native cartilage, providing mechanical support and promoting cell proliferation and differentiation. By combining cells, scaffolds, and growth factors, tissue engineering holds promise for producing durable, functional cartilage implants for arthritis treatment. Nutritional and lifestyle interventions. In addition to regenerative therapies, nutritional and lifestyle interventions play a crucial role in supporting cartilage health and promoting arthritis management. A balanced diet rich in anti-inflammatory foods, such as fruits, vegetables, omega-3 fatty acids, and antioxidants can help reduce inflammation and support joint function. Regular exercise, weight management, and stress reduction techniques can also contribute to overall joint health and arthritis symptom relief. Implementing a holistic approach to arthritis treatment. Effective arthritis treatment requires a multifaceted approach that addresses both symptoms and underlying disease mechanisms. By combining regenerative therapies with nutritional support, lifestyle modifications, and holistic interventions, individuals can optimize their chances of cartilage repair and joint preservation. Consultation with a healthcare provider specializing in regenerative medicine can help guide treatment decisions and personalize care to individual needs. Conclusion. Traditional approaches to arthritis treatment often fall short in addressing the root cause of cartilage degeneration, leading to ongoing pain and disability for many patients. However, recent advances in regenerative medicine offer hope for a paradigm shift in arthritis management, with a focus on truly regenerating cartilage and restoring joint function. By exploring innovative therapies such as PRP, MSCs, tissue engineering, And adopting a holistic approach to care, individuals can take proactive steps towards lasting relief from arthritis pain and improved quality of life. Embrace the journey to cartilage regeneration and discover a brighter future free from the limitations of arthritis.